Hi there, my name is Dr. Carlie Arbaugh, and I'm a general surgery resident here at Stanford Healthcare. I'm going to be presenting research that was conducted along with Dr. Cynthia Kimura, as well as our faculty advisor, Dr. Cindy Kin. This project is entitled Gastrointestinal Surgical Patient and Multidisciplinary Healthcare Provider Beliefs and Practices Around Perioperative Nutrition, a Mixed Method Study. And this is a subset of work that we've been working on over the past 1.5 to 2 years. So to begin, I just want to review that nutrition is a critical part of gastrointestinal disease, both prevention and treatment. And this includes operations, and so is relevant to us as surgeons. Still, perioperative nutrition practices vary widely between departments, hospitals, and providers. And so through this research, we aim to better understand gastrointestinal surgical patient and healthcare provider perioperative nutrition beliefs and practices. And we wanted to use that understanding to inform various pilots and interventions to impact patient nutrition. In terms of methodology, we used a mixed methods approach. This included a patient survey of 19 postoperative patients at Stanford Hospital, as well as a provider survey, which included 26 multidisciplinary healthcare providers, and then semi-structured interviews with a subset of those providers, including 15 providers. The multidisciplinary providers were composed of surgeons from the colorectal, surgical oncology, and hepatopancreatic biliary services, gastroenterologists, medical oncologists, advanced practice providers or APPs, as well as dietitians and nutritionists. The provider interviews were transcribed, iteratively coded, and thematically analyzed, and then we integrated our quantitative and qualitative data. In terms of results, I want to begin by reviewing the patient demographics and provider demographics of our study populations. Patients were between ages 26 and 83 with a mean age of 60 years. Our patient population was 47% female and the rest were male. This information was gathered from the electronic medical record. And in terms of race and ethnicity, our patients were primarily white and non-Hispanic, non-Latino, although other groups included Asian, Indigenous, and then another category which was not defined. And so as you can see, we were missing a lot of patient data when it came to race and ethnicity, which is a limitation of the study. For provider demographics, our providers ranged in age from their 20s to their 60s. They were 46% female and the rest self-identified male. And roles that they played in the hospital were 35% surgeons, 23% medical oncologists, 19% APPs, and about 11.5% gastroenterologists, and as well as dietitians and nutritionists. And so, like I mentioned, we included a lot of different questions in our surveys and interviews, and I won't have time or space to review all of that data today, but I did want to focus on a subset of that data. And so looking at the first table in the middle of the poster, I wanted to talk about perceived importance of nutrition and surgical outcomes from both the patient and provider perspective. We asked both patients and providers to what extent they feel nutrition impacts surgical outcomes. And as you can see on the right-hand side, nearly 100% of healthcare providers felt that nutrition impacts surgical outcomes somewhat or to a great extent. And on the left-hand side, you can see that 95% of patients believed that nutrition impacts their surgical outcomes somewhat or to a great extent. And this is similar or more than factors that we looked at, such as disease severity, complexity of surgery, and physical activity level going into surgery. We also noted that nutritional supplements such as Ensure, Nepro, Boost are very commonly part of perioperative nutrition practice. Many of our patients commented that they had received these from their providers either before or after surgery, and many providers affirmed that they do prescribe or recommend these products as part of their nutritional care in the perioperative period. However, we were curious about patients' experiences with these traditional nutritional supplements, including both likes and dislikes of using them. And so as you can see in the second table in the middle of the poster, On the left-hand side, things that patients liked included the perception that nutritional supplements are healthy. They were told by their healthcare teams that they're an important part of their perioperative care. They also commented on the amount of protein as well as the vitamin supplementation, and then the ease of the use of nutritional supplements. On the right-hand side of the table, you can see that there are a number of things that they didn't like about the nutritional supplements, including sometimes poor taste and consistency. Many patients noted that nutritional supplements can be poorly tolerated from a gastrointestinal perspective, so can be associated with symptoms like gas, indigestion, nausea, vomiting, and diarrhea. Numerous patients noted that, particularly when they were getting chemo or radiation, nutritional supplements didn't really sit well with them. Many patients felt that the nutritional supplements were too sweet and were worried about the amount of sugar that was added to these products. And then they also noted the temperature. When the nutritional supplements are served in the hospital, it generally happens at the beginning of the day. And then by the time patients were ready to drink these supplements, they often were room temperature or warm, and so not very palatable. And so this led us to develop actually a multidisciplinary task force here at Stanford Healthcare, including several surgeons, dietitians that care for postoperative patients, as well as food services leadership staff and a culinary consultant. And so we've worked on a number of projects, but relevant to the results that I just shared, we did pilot and then implement a plant-based protein smoothie on the Stanford Healthcare inpatient menu. And the reason why we did this is we wanted to offer an alternative to traditional nutritional supplements that was house-made, more healthful, better tasting, better for the environment. And so we were able to accomplish that, and that's now offered to our patients. In addition to that, we've also worked on some revisions to the postoperative inpatient menu, such as removal of red meats and processed meats, given the strong evidence that these are carcinogenic, and many of the patients that we care for actually are getting cancer resected or have cancer. And so we didn't want to have these foods on the menu and be contributing to that risk. And then lastly, I wanted to note that we discovered that patients really do seek and gather nutritional information from diverse resources. So things like websites and blogs, documentaries, books, magazines, people, especially family members and significant others, as well as nutritionists and dietitians. And so as we continue to brainstorm and develop additional interventions in the future, this is helpful for us to know how to distribute that information to our patients. And then lastly, in our interviews with providers, we determined that there really is a lack of quality information for providers when it comes to nutrition. There's a lot of misinformation out there. And then there's also inconsistency when it comes to the practices that healthcare providers are using in perioperative nutrition. And so those are some of the barriers to high quality nutrition care. And so when we're working with providers, we're also going to keep those in mind. Thank you very much for listening, and I welcome your feedback, questions, comments. You're welcome to email me. My email is listed here in the bottom left-hand screen, carlie@stanford.edu.